So why is scar tissue so important? And if it's so important, why isn't anyone talking about it?
Well, scar tissue is reality for just about anyone who has a body who's ever been injured. And a lot of women, in particular, sustain injuries when they give birth. I think the actual statistic is somewhere around 87% of women sustain some sort of birth injury or surgery coming out of that experience. And I think people don't talk about it for a number of reasons. The first thing that comes to mind is shame, that people are afraid to acknowledge that they're having pain after childbirth that's affecting their urinary function or affecting their elimination function and certainly affecting sexual function. People don't necessarily, I mean, women in particular, may not feel comfortable approaching their doctors to explain the changes in their sex life, whether it's painful intercourse or whether it's a change in the configuration or the way they feel about the way they look in their pelvic floor. There are a lot of issues that things are different after childbirth, and I don't think women are really prepared for the changes that happen to their sexual selves. And they don't necessarily know how to talk about it and are maybe not encouraged often by their doctors to talk about it.
Right.
So there's a shame aspect, potentially an embarrassment aspect. But I also think that even in the medical community, there's no expectation or no training around scar tissue per se,
Right.
because it happens in connective tissue, and connective tissue still is taught as an inert tissue in medical school training,
Right.
that it isn't alive, it isn't intelligent, it isn't active. And from my studies and from my personal experience, I've noticed that scar tissue and connective tissue is certainly active. It's an organ of communication, and it holds memory and can reflect memory back. As I've worked with tens of thousands of hours of clients and their scars, their memories, their pain, their traumas, so often people will relive a moment. For a woman, it could be a moment during her birth, a moment when she felt betrayed by her body or potentially betrayed by her doctor, her OBGYN, or even her midwife, or possibly even her doula. There are moments that come up what women are not prepared for in the birth scenario.
Yes.
And they may feel like, oh, nobody told me it would be like this. There's so much pain, or I feel so out of control, or I am not getting the support that I expected to get. It's just not like what I thought it would be. And I'm frightened and I don't know what to do with that fear, but there's no choice at this moment but to move forward. This baby's coming through me, and I am going to roll with it somehow. But if there's fear, or if there's a strong fight, flight, even a freeze response can come up during the birth process, and the body encodes that as trauma, but at the same time, the process is moving forward regardless of the woman who's giving birth.
Right.
There's a sense of helplessness, and that sense of helplessness gets encoded in the connective tissue as a meme, as an idea. And I think that and then it becomes submerged because there's the needs of the mother are ignored and basically put to one side in favor of the needs of the baby immediately after birth. And so that injury, that tearing, that potential surgery, episiotomy, C-section, however the birth ends, or whatever procedures happen during the course of the birth, basically get sublimated in favor of the needs of the child.